Alright, so I'm going to be talking about radiation therapy. A little introduction. Radiation therapy is a type of cancer treatment, and with cancer being one of the leading causes of death in the United States, it has become one of the preferable treatments for cancer. It has long been used for treatment, but for years it was regarded as a second treatment choice. This was after surgery was no longer an option. Like I said, it is a cancer treatment. It uses beams of intense energy to kill cancer cells. It most often uses X-rays, but protons or other types of energy may be used. It is a lot more common today, and they use it for both curative and palliative purposes. So the goal of radiation therapy is to deliver a sufficiently high dose of radiation to sterilize the tumor cells with minimal damage to surrounding tissue. The hopeful end result being total eradication of the tumor with minimal damage to the surrounding tissue. This is to allow for normal and sufficient function after treatment. So going into tumor radiobiology. So malignant tumors, like normal tissue, consist of a parenchymal compartment. And the parenchymal compartment consists of 4 different subcategories. So group 1 is the well-oxygenated, viable, and actively proliferating cells. Group 2 is the well-oxygenated, viable, but not proliferating cells. And group 3 is the hypoxic but viable. And group 4 is the anoxic and necrotic. So going a little bit into the subcategories. Group 1 is termed the growth fraction, or the GF. This is responsible for tumor growth, and this group is actively dividing, and coupled with its well-oxygenated state, makes these cells the most radiosensitive. This is also only in relation to the other groups, not to the rest of the cells in the body. So group 2 contributes to tumor growth as well, and it consists of Q cells. And these cells provide a source that repopulates a tumor after treatment is over. Group 3 poses the biggest problem clinically because the hypoxic status makes these cells more radioresistant, and they also provide a source that repopulates a tumor after therapy or treatment. And group 4 is the non-viable cells that have no relation to tumor growth nor to the treatment outcome. So going into tumor growth, it's measured in terms of doubling time and is dependent on 3 factors. The first factor is the cell cycle time of the proliferating cells. So the cell cycle time of malignant cells is a lot shorter than that of normal cells. The second factor is the growth fraction. This is the fraction of the total tumor cell population that's dividing. And the third one is the degree of cell loss from the tumor, so like metastases and apoptosis. So going into the uses of radiation therapy with cancer patient, it can be used as the only treatment for certain cancers, but it really just depends on the track that your physician wants you to go through or what the patient decides is best for them. It can also be used before surgery to shrink a cancerous tumor because sometimes during surgery it's easier to get a smaller tumor than a larger tumor. Or it can also be used after surgery to stop the growth of any remaining cancer cells. So this is like any cells that they may have missed during surgery or we're not able to get to while doing surgery. It can also be used alongside chemotherapy. So radiation therapy and chemotherapy together allows for destruction of cancer cells. And in advanced cancers, it can be used to alleviate symptoms for these patients that have went through chemo, went through surgery, and there's just no other options left. Sometimes radiation therapy can be used just to alleviate the pain of these patients. Some side effects associated with radiation therapy. So this goes into different parts of the body where you can get radiation and what symptoms that can come along with it. So for any part of the body, you can experience hair loss at the treatment site, skin irritation, or fatigue. For head and neck radiation, you can experience dry mouth, thickened saliva, dysphagia, sore throat, taste changes, nausea, mouth sores, or even tooth decay. For chest radiation, you'll see a lot of dysphagia, cough, or shortness of breath. And for abdominal radiation, this is like nausea, vomiting, and diarrhea. And then for the pelvis, you'll see diarrhea, bladder irritation, frequent urination, or sexual dysfunction. So there are two different types of radiation therapy. There's external beam radiation therapy, and there's also internal radiation therapy. First, I'm going to go into the external radiation therapy. So this is the machine that aims the radiation beams at the cancer area. It will also move to send radiation from different directions. This allows for the radiation, for the tumor to be exposed all the way around by radiation. It is considered a localized treatment because it's only hitting a specific part of the body. So wherever the tumor is located, that's where the radiation beams are aimed. Now, internal radiation therapy, this is a treatment in which a source of radiation is put inside the body. The source can either be solid or liquid. For the solid source, they're usually called brachytherapy. This uses radioactive seeds or ribbons or capsules inside the tumor or just near the tumor, but inside the body. And it's also considered a localized treatment because it's only affecting the tumor itself. Then the liquid source is commonly known as a systemic therapy. So the treatment travels in the blood to the to tissue throughout the body, and it aims for the cancer cells in order for the radiation to take out the cancer cells. The route of administration usually is going to be oral, intravenous, or injection. And thank you for listening.